There are many of us who feel that the microscope should have been made the standard of care many years ago, and many of the problems our specialty is experiencing today stem from that failure to establish the microscope as the standard, and it is a very sore point still for many of us. Our specialty is contentiously, perhaps hopelessly divided on many levels. One area of stark disagreement is how we view the role of the microscope in endodontic practice. For some, it is the foundational principle in a practice, and it is used for everything. For others, it's just another tool, an adjunct, to be used when needed and put away when not needed. These really are two very different visions, and they affect almost all aspects of clinical practice, as well as how technique is taught in our postgraduate programs. A contrast of visions can be a very serious issue within a specialty, and this is no exception. Perhaps the dominant view within our specialty is best characterized by Dr. Kim's view as expressed in Dental Clinics of North America. This is how it reads, and I quote, "Some authorities claim that the microscope must be used for all steps of microsurgical endodontic procedures. This may be a noble idea, but in reality is not needed or desired." Contrast that with our view, which is best expressed in our Best Practices Handbook by Quintessence that came out in 2015. It reads, and I quote, "Working in an environment where the microscope is constantly being moved in and out of the field is extremely inefficient and tends to be very distracting for the doctor, assistant, and even the patient. Such a practice model fragments continuity of care, reduces focus and concentration on the task at hand, and has the end result that the majority of motions required are class 3, 4, and 5 motions, thus dramatically decreasing efficiency and affecting both health and efficiency. You can see here we are talking about both the physical and cognitive aspects of ergonomics, especially as it relates to the fragmentation of care and the disruption of clinical focus and concentration that ensues by not using it for everything. So to start, let me first communicate what my vision is to you. And it isn't this, with the microscope in the background and the doctor hunched over the patient. Many, perhaps most endodontists actually work something like this.
The idea that you pull out the microscope only when you really need it is one that unfortunately dominates our specialty, and it has had disastrous consequences for us as a specialty, and has had many deleterious effects, not all of which are obvious, unless you are a very careful observer. Others have said, "Wait a minute, Gary, that's an artificial construct," but actually, it isn't. I know many people who work exactly like this, and maybe worse, and I can post hundreds, perhaps thousands of pictures from websites that show exactly this sort of use. Doctors working at crazy angles, assistants standing up or in contorted positions, doctors shown doing some things with the scope and other things with loops, doctors shown using the scope only as a light source or coat rack, or working in ops so poorly designed as to make efficient use of the microscope almost impossible. Some TDOers were kind enough to film themselves and let me show them at work in their environments.
So what you see is even among TDOers, you don't have the use of the scope from start to finish. Instead, you have this kind of hybrid approach, doing some things with it and other things with the loops or the naked eye that is actually very inefficient and ergonomically stressful on the body. My guess is that this is how 90% of you actually work today, and it doesn't need to be like this. So let's make sure we make this argument accurately. As I wrote in the Best Practices Handbook, the significant consideration in this regard is not, is the microscope required to perform this task, but rather, by performing one set of tasks with the microscope and another set without, is ergonomically efficiency negatively affected? And the answer to that question is almost always yes. So let's frame the question a little differently. Instead, let's ask a different question. What happens to your efficiency, your health, your profitability, your frustration level, and your team members, and your organizational culture when you do some procedures under the scope and other procedures with the naked eye or loupes. And when you answer that question, the answer will point you in the right direction. We do everything under the scope, not because we need to, but because it is easier and more efficient and healthier. Our training is better, our culture is better, our enjoyment is better. And we do not suffer from either physical stress or the aforementioned issues with focus and fragmentation of care. The assistant and the doctor are completely focused on the case at hand without the distraction of going back and forth from loupes to microscope. So what is our vision? To review. 1, do everything under the scope. One way is to take the overhead light out of your op and force yourself to do it. Make sure your assistant can see everything that you can see. Remember, you are a team. 3, record all data ergonomically, and by that I mean contemporaneously. Accurate and contemporaneous record keeping is a function of ergonomics, and it affects both accuracy and profitability dramatically. Do your reports ergonomically, by which I mean finish your reports before the patient leaves the office. That's the single most important thing you can do to relieve stress in your office. So this is our vision. I want to emphasize this is not a new vision. We've practiced this way for 20 years, and we have some experience in knowing how to do this and where the stumbling blocks are. So this is how we work, doing everything under the scope from start to finish. Always upright, almost never changing position. Today we have GoPro cameras installed everywhere in our office. And the video material you will see today is from treating actual patients and represents an accurate portrayal of how we actually work, warts and all. All documentation is done in real time, not after the fact. Notice the monitor is ergonomically positioned right in front of the assistant, so she can assist and document simultaneously, and our reports are done the same way, contemporaneously, not after the fact, and are ready before the patient leaves the office. Since we have worked this way for over 20 years, this is what I can promise you based on my own experience and having trained over 1,000 clinicians and assistants in that time frame. Number 1, without question, it is easier to work this way, far easier. Number 2, it is faster. Those who are properly trained know that it is faster, perhaps 20 to 30% faster. I can prove it. Number 3, it is better. In nearly all regards, you may not think you need a scope to give anesthesia or to put a dam on, but I can assure you that it is done better with a scope. I will show you why today. It is demonstrably healthier to do everything under the scope, both for you and your assistant. We will show you today why it is also much more profitable to work this way. So it's easier, faster, better, healthier, and more profitable. Why all the resistance?